Hello, and welcome to the WPC virtual webinar series. My name is Eli Pollard. I'm the Executive Director at the World Parkinson Coalition. And this program has been a long time coming, starting back in 2019 at the Fifth World Parkinson Congress in Kyoto, Japan. There were a lot of conversations about resources and services for people with young onset Parkinson's disease. And that conversation seeded this idea for a course. We actually took that information in 2019 and offered a live in-person pre-Congress course at the Sixth World Parkinson Congress in Barcelona, Spain in 2023. There were a lot of people who could not join us in person in Barcelona, and they let us know that they really wanted access to these courses. And so, because of their requests and because of interest within the community, we are now offering this course live virtually for everyone to access. So it's important to note that this entire program is being offered 9 talks in all. They were all designed by people with Parkinson's, particularly people with young onset Parkinson's, designed for other people with YOPD or people who want to learn about YOPD issues. You're going to hear this week about a wide range of topics, from parenting in Parkinson's to exercise in Parkinson's to when and how to make a disclosure about your diagnosis. The topics are wide and varied, and our faculty are true leaders in the Parkinson's world, with 20 faculty members. 12 of them are people who actually live with young onset Parkinson's disease themselves. Other faculty are care partners, movement disorder doctors. We have a nurse, we have a physical therapist, and others. It's really an incredible lineup, and you're in for a great treat. And if you miss a session, don't worry, we're recording them all, and they will be available for viewing as archive talks in the coming week. I want to thank Mitsubishi Tanabe Pharma America for supporting the WPC and bringing this program to you. We would not be here today without their support. So thank you, Mitsubishi Tanabe Pharma America. And lastly, I want to thank our faculty for sharing their knowledge, their experience, their expertise, and to all of you for joining us today and for supporting the WPC and our work throughout the year. Thank you, and enjoy the session.
Welcome to the World Parkinson's Coalition's virtual YOPD program, everyone. My name is Tim Haig. I'm going to be your moderator for the next hour, and I'm joined by our presenter, Miriam Rafferty.
Hey, everyone.
How you doing, Miriam?
Good. How are you?
I'm shaking along,
Okay.
as we like to say. Well, our session today is on exercise and wellness. We are both pleased to have you join us today. If you're not already aware, the 9 talks in this virtual YOPD series each fall under one of these three categories. The individual track, these talks focus on the individual living with Parkinson's, such as ours. The relation track, these talks focus on the importance of relationships. The medical track, these talks focus on the medical management of Parkinson's with a focus on YOPD. Now, if you missed a session this week, never fear, because we are recording them and they'll be available by next Monday for you to view. Now, during this session, you will notice a box up on the right side of the screen with 3 tabs. A question tab where you can submit questions at any time, and I will be back to share those with Miriam and ask those questions. A resource tab where you can download or open various resources mentioned in the session. A poll tab, and we will have a poll in this session, where you may be invited to complete a poll in the session. Not all sessions have polls, but if they do have, like we will, the tab is where it will show up. Lastly, if you want to thank our sponsor, I would want to thank our sponsor, Mitsubishi Tanabe Pharma America. We would not be here today without their generous support. So let's get started. Well, first and foremost, my name is Tim Haig. I'll be your moderator for today. This next March will mark 14 years since I was diagnosed with PD at the age of 46. Since that time, I've gone on to win the first season of the reality television show, The Amazing Race Canada. I've become an author, wrote my first book, Perseverance, and I'm a professional speaker, and I am the founder of U-Turn Parkinson's and co-founder of the PD Avengers. And I'm just going to throw in here for you, you will get full display of my Parkinson's and my DBS today, because I'm playing with it, upping and increasing it and decreasing it, trying to get my voice to work properly for you. So we'll see how that goes. The U-Turn Parkinson's is a wellness center whose goal is to empower people living with Parkinson's. We are believers in the idea that exercise is medicine. Thus, we take a holistic view of health while having a heartbeat for exercise. It is our aim to be a center of excellence, providing condition-specific, holistic, research-based programs free of charge to the Parkinson's community. You can learn more about what we do at U-Turn Parkinson's at uturnpd.org. Join one of our many classes or support groups and learn to live your best with Parkinson's. The PD Avengers is a patient-led organization united in the purpose of ending Parkinson's disease. We raise awareness, engagement, and hope. We add urgency to the cause of ending Parkinson's. For PD Avengers, a think global, act local philosophy reflects our belief that change starts with individual action, but grows through collective effort. It's how PD Avengers is building a future without Parkinson's, one community at a time. Join us at pdavengers.org. Now, it gives me great pleasure now to introduce our speaker for today's session. Dr. Miriam Rafferty is a research scientist, the Director of Implementation Science, and physical therapist at the Shirley Ryan Ability Lab, as well as an assistant professor at Northwestern University's Feinberg School of Medicine in the Department of Physical Medicine and Rehabilitation, and Psychiatry and Behavioral Science. She is a board-certified neurological physical therapist who works with people with Parkinson's disease. Dr. Rafferty completed her clinical doctorate in physical therapy from Washington University in St. Louis and earned her PhD in neuroscience from the University of Illinois at Chicago. Dr. Rafferty's current research focuses on health services delivery models for people with Parkinson's disease, particularly examining how proactive rehabilitation can facilitate long-term community exercise participation. She also uses implementation science methodology to improve adoption of evidence-based practices and conducts research to inform the implementation of novel technologies in the real-world rehabilitation settings. Please welcome Dr. Miriam Rafferty. There you go, Miriam.
Thanks, Tim. That was a great introduction, and I'm really excited to be here and thank the sponsors at Mitsubishi Pharma for their support to bring back this presentation. So I first presented this talk at 2026 at the World Parkinson's Congress in Barcelona. And I've updated the slides since then, and we'll talk about some of the latest research as I go. But first, I have a couple of housekeeping slides with just disclosures for, I lost my slide there. There we go. Disclosures for the funding that I've received for research from the U.S. Department of Defense and NIH. And some of the things that I would like to kind of talk about today, I'll talk about the existing Parkinson's exercise recommendations. I'll talk about how we can facilitate exercise and who might play a role in doing that for you. And then I'll talk about maximizing motivation and adherence. So before I begin, I do have a poll. And this poll is to learn more about you, our audience, to learn more about how much you exercise, where the options are none. What's exercise? My couch and I are best friends. Rarely. Well, maybe when my partner chases me out of the house, or maybe you're a weekend warrior for your exercise. Sometimes I like exercise, but probably I don't do it as much as I should. I'm partway there. Or do you give yourself a super exerciser rating that you're exercising 5 or more days a week? You'll see this in the polling tab on your screens, as Tim mentioned earlier, I think it was at the top right. And while you guys are finding that tab and answering the poll, Tim, I'm curious, can you tell me, where are you now? How are you going to answer this poll now? But also, where were you after diagnosis and maybe about a year or so after that?
Well, Miriam, I'm fairly lucky that my exercise habits have served me quite well over time. Before being diagnosed, I was very active. I ran a fair bit, cycled a lot, and I was preparing for my first triathlon, sprint distance, it's a short one, when I was first diagnosed. So I carried through with that even after I was diagnosed, I went ahead and ran that sprint distance triathlon. I'm thinking how much I shook back then, which is nothing compared to today, right? But carried on. After the triathlon, I was just exhausted from it, of course. And I'm like, who wants to carry on doing this nonsense? So I actually stopped doing most of what I was doing, in training at least. I always rode my bike to work, so I kept some stuff going. In large part, I let it really fall off after diagnosis because, of course, I got depressed a bit and got down. But that lasted 6 months or so, and I finally got back at it. And I've been very consistent with my running and exercising since then. Yeah, I can't say that there's a whole lot of difference in my routine from that point from today. I do about, my goal now is to have about an hour a week, an hour a day of exercise, with Sundays being an active planned rest day. So an hour a day, generally at U-turn. I spend a day there at the gym in one of our classes, and then on the days that I'm not there, I'm either cycling or running. So that's the plan.
Thanks. And I will share my exercise positionality statement here. It's one of the things we like to do in research, is making sure you understand where we're coming from on this. I was an exerciser in my younger years, and in college I played sports and I loved to run. But having kids is what helped me fall off the bandwagon for exercise. And say it's been 2 weeks now. I am back on the bandwagon. I signed up at a gym where I have a commitment to go 3 times a week.
Excellent.
And if I do that for the first month, I get the next month free. So that is going to be a big facilitator for me to go this month. And hopefully I can get this to stick, because yeah, I need to get back on the bandwagon.
Yeah.
So I'm curious now if our poll results are complete. Okay. So what we have here, we have nobody who answered that they were not exercisers. So that's great.
Excellent.
We do have a large amount of people who say that they do exercise sometimes. And the next highest level, about 30% of you are super exercisers already. I am jealous. You guys are doing great. And a few people who are exercising rarely, but it's great that you are here. And I hope that we can inspire you to increase that just a little bit. Thank you. Okay, back to the presentation. So we're all here because we know exercise is good for you, and it's good for your heart. It's good for your brain. It's good for your whole body. Parkinson's or no Parkinson's, exercise is good for you. Parkinson's specific research, though, shows that exercise can improve your walking, your balance, strength in people with Parkinson's, mobility, your range of motion. The motor disease severity score can be impacted by regular exercise participation. That's when your neurologist has you do the hand waves and the foot tapping. That score, which represents your disease severity for the motor systems, can be better if you start to exercise regularly. Quality of life can be better if you exercise regularly. Really excitingly, I think the non-motor symptoms can also be helped by exercise, which includes mood, cognition, things like anxiety and depression. And I think this is one of the hard things, because mood, problems with anxiety, depression, and apathy that are common and very, very common in Parkinson's, they make it harder to exercise. But if you can get yourself into a routine, it gets easier to stay in that routine. And then the other thing exercise can do is increase your aerobic capacity, which is good for your heart and your lung health. Recommendations now from all of the guiding bodies say that we should be helping you exercise. Specifically, the American Academy of Neurology and International Neurology kind of groups or professional organizations say the same thing, that neurologists should be recommending that you exercise 150 minutes a week of at least moderate intensity aerobic exercise. And they should discuss rehabilitation, so PT, OT, and speech, and how those could help you annually. In the European Union, there's a Parkinson's group that also Canadian Parkinson's guidelines, UK Parkinson's guidelines, and Spanish Parkinson's guidelines all say specifically that you should consider, that neurologists should consider recommending an early intervention program by a physical therapist to address individually tailored exercise prescription and physical activity. And I include that one there to know that there are people out there that can help you with your exercise prescription, with all those questions about what should you do and how hard should you work and what's safe for your body. Your rehabilitation providers can help. Now, physical therapists are the rehabilitation providers, which in the US and Canada, to some extent, in most kind of the high income Western European countries as well, are the profession that helps with exercise. They can prescribe aerobic, strength, and balance exercises to help with all the things I mentioned on the last slide. And also they should be using behavior change techniques to help people with Parkinson's to improve their general physical activity. So those are really important roles of physical therapists, but I have to say they're probably a little bit of new roles for physical therapy. traditionally people thought physical therapy was a place where you go when you're having problems, like your knee hurts. And so you go to a PT to fix your knee. Or with Parkinson's, more advanced in the disease, you fell and you need to work on your balance. But now we know, and the research is showing that early intervention with exercise is so important. We should be referring to PT early, and PT should be doing, regular exercise stuff, not just balance training for more advanced disease state.
How early, Miriam?
Right after diagnosis. I'm really lucky at Northwestern. That's a great question. Our movement disorders neurology team is very exercise oriented, and we have had people that are referred to our early intervention Parkinson's program who actually have prodromal Parkinson's symptoms. So they do not have a formal diagnosis of Parkinson's, but they have REM sleep behavior disorder and decreased sense of smell. And that is a group that has a higher incidence of developing Parkinson's. And if they have that, some of those people are getting referred to the movement disorders neurology department proactively, and then they'll pass them on and refer them to PT. But that is rare, very rare that we see prodromal people. But we do see about 50% of the people in our early Parkinson's program are coming within the first 6 months of their diagnosis.
That's excellent.
So in my world, the question is no longer whether we should be exercising, which it sounds like most of you are already agreeing. It's which exercise to do, how much, and how do you actually work that into your daily routine? That's just such a challenge. So to kind of level set the spectrum of physical activity and exercise starts with sedentary sitting and laying. Right now, we are all in the red zone. We are sitting at our desks or on our couch thinking about exercise. On the other end of the spectrum is vigorous exercise. This is aerobic training. It also includes strength training, like circuit training, where you're really pushing your body, where you're getting your muscles to get tired and you're getting your heart rate up. And then also fast cycling, rowing, swimming. There's a lot of ways to achieve vigorous exercise. One thing to think about exercise, though, is it's not just walking your dog. So a sustained brisk walk could be moderate intensity exercise. Leisurely cycling, just maybe your commute, for example, some people might go vigorous, but from a safety perspective, you might be stopping and starting moderate. That's generally moderate intensity exercise. Light physical activity would be housework, yard work, walking your dog, in balance and flexibility, while exercise are more of a light level. Exercise specifically is a subset of physical activity that is planned, structured, and repetitive with an object to improve or maintain physical fitness. I'm pretty sure the word that they were trying to avoid there when they say that it is planned, structured, and repetitive is exercise is boring. So there's got to be other ways to make it fun sometimes, because just getting on a treadmill or getting in the pool and going back and forth, there are things that by definition make it not very exciting. Okay. So I've kind of mentioned this already, but with Parkinson's specifically, we think of 4 main types of exercise: aerobic exercise, strength training, stretching, and what I like to call the BAM exercises, or balance, agility, and multitasking. In the American College of Sports Medicine, they call this neuromotor exercise. But in general, we're looking at balance, agility, and multitasking there. The Parkinson's Foundation worked with the American College of Sports Medicine to develop exercise recommendations. And a link to these exercise recommendations are in your resource list, so you can go online to download themselves. You can even order a poster if you would like to have a poster in your home. But the Parkinson's exercise recommendations include aerobic activity, strengthening, the BAM exercises, and stretching. This fact sheet that's downloadable has kind of a little bit more information on the dose of exercise. For aerobic activity, it's 3 days a week for at least 30 minutes per session of continuous or intermittent moderate to vigorous intensity exercise. For strength training, it's 2 to 3 times, non-consecutive days. If you strength train 2 days in a row, you're more likely to kind of have some injuries there. You should be going for about 30 minutes a session and doing 10 to 15 repetitions for major muscle groups. 10 to 15 repetition is really working your muscles out for endurance. The types that you could do I've mentioned those already for aerobic exercise, for strengthening, I mentioned circuit training, but there's no research to suggest that any one method of strength training is better than another. You can use weight machines at a gym. You can use dumbbells in your home. You could use resistance bands. You could use, you can use cans of soup as a 2-pound weight. But the only thing that they say is the kind of the best type of strength training would be that it has to be hard. So when you do your 10 to 15 repetitions, by the time you get to that 15th repetition, you should be stopping, or you should be getting tired. So like that, repetition 1, 2, those are easy. 14, maybe your arms are shaking a little bit, and then you stop. You don't push too much past that shake, because then you're more likely to get injured. You want to push to the shake, do 1 or 2 reps where it's a little bit shaky, but then before you're like sticking your chin out and doing something crazy with your body to get that weight up, you need to stop before that. But strength training should be hard. If you can do 15 repetitions and you're just going through it, you're not tired at the end of that, and you're like, oh, I can do 3 sets of 15, you need to increase the weights that you're lifting. There are some safety considerations for these exercises. So depending on your walking ability, how you're doing, your aerobic exercise might matter. That treadmill might or might not be safe for you. There are risks with Parkinson's disease of low blood pressure, especially if you go from like lying on the floor to standing up. And there's also an increasing number of people now with Parkinson's who have what we call a blunted heart rate response to exercise. So if you feel like you are going all out and you are on that treadmill walking as fast as you can, you've put it on an incline, and no matter how hard you work, you're not getting to those recommended heart rate zones for your age, it could be the Parkinson's, and it also could be a side effect of your medication. So that's when you'd want to seek professional help to see what is the best exercise range for you. For balance, agility, and multitasking exercise or neuromotor, we're looking at doing that a couple of days a week. If you're doing it like a class, like if you do a yoga class that includes some stretching and some balance, you want to do that a couple of days a week. But one of the best ways to do balance is to integrate it with your daily routine. So while you're watching TV, do some agility, some mini squat exercises, standing on one leg. While you're brushing your teeth, try to stand on one leg. Just try to figure out if there's little ways that you can work it into your life. Now, one of the things that some people, when we first released these guidelines in 2021, there's another table that goes along with them that goes into more detail. That table is meant for exercise professionals to help them know how they should be helping you. So if you work with a trainer at a gym, share this with the trainer. Share that bigger table that also is linked in your resources with your trainer, because it can get a little bit, it's a lot to think about on your own. Like, how am I going to dose my exercise? There's so many things to think about. You've basically just given me a full-time job of exercise, 2 to 3 days a week, an hour of this, an hour of that. Pretty soon you're at 3 hours a day, 5 days a week, and it's just not possible, right? And this is where I think seeing a professional can help. This is what the dosing information looks like for levodopa. You don't dose your levodopa by yourself. And that's why I think if you're struggling with exercise, don't try to dose it by yourself either. Work with a professional. I mentioned some of those safety considerations also. And so here are some of them, if I kind of do a search on the internet for what things come up for safety for Parkinson's, as well as the literature. Some of the things that I mentioned already are the blunted heart rate for exercise or your walking, and how your walking could increase your risk of falls. Nutrition and hydration are also important, particularly if you're working out hard. Those are really important for how your medications are processed in your body. So it's not just the regular, I need to stay hydrated. There are extra considerations because of your Parkinson's. There'll be more talks through this series from a nutritionist kind of talking more about nutrition. Make sure you're doing warm up and cool down. Think about your pelvic floor. Those muscles in your pelvic floor, which are the ones that kind of support the bottom of our pelvis, which includes our bladder, they can be weakened in Parkinson's and stiff in Parkinson's the same way other muscles can be weaker and stiff in Parkinson's. So if you're having problems with incontinence, if you're trying to do kind of walking on a treadmill or something that's more high impact, pelvic floor physical therapists can help give some exercises to strengthen those muscles. One thing to mention, I mentioned my own exercise journey, and this was a family incident, but kid safety. The talk before this, many of you were on that. If you have children at home, make sure you keep your weights in a safe location. because this weekend with Thanksgiving holiday, my nephew, who's a 2-year-old, tried to lift my mother-in-law's 9-pound kettlebell because it's a ball, right? Like 2-year-olds just want to lift it. And he dropped it on his foot and had to go get a very minor procedure to drain his big toe and has a broken toe. So be careful with your equipment in your house because those accidents do happen. So these are all of the safety considerations that you might want to think about. Tim, I'm curious for you if any of these issues have come up with you with your medications or any of the heart rate stuff or anything else.
No, I've had no real complications at this point, which has been, I feel very fortunate about. I've always been a bit cautious. We have 4 kids. We were a single income family, and that was on me. So as a nurse, I couldn't afford to run too hard and get stress fractures or wreck my bike or any of those things. So I've always been pretty cautious in how I've moved forward with my exercise, and I've avoided most problems.
That's great. When you've done some of your more kind of extreme working out, not that I recommend extreme working out for everybody, it's definitely not for everybody, but have you had to do anything specific for your nutrition and your medication?
Oh, for sure, for sure. Nutrition is always important. I've had to play with what would actually keep my blood sugar up. For whatever reason, I had trouble. I burn all the sugar in my system and be not doing too great. So I learned to drink Boost early in my life, and it's been a constant when I'm doing heavier working out. And then medication. Well, me and my doc had a open relationship with medication right from the beginning, because at the beginning was the triathlon, and I asked him. I said, "Okay, so if I'm going to take this medication, how do I dose it while training?" He said, "I don't know. I've never had anybody run a triathlon before." So I was fortunate again that I was a nurse. So the two of us just worked together. He gave me a range, and I played with that range of medication. I played with the time, played with how much I took, and figured out what would work for me. But the important thing in that is to hear that we worked together on it. This wasn't Tim making up a plan on his own, but my doc was involved with it, and he oversaw what I was doing. You have to go a long ways to hurt yourself with levodopa, but we managed to seem to be able to do most anything. So make sure you're talking to your doc before you do anything.
Thanks. Yeah, no, that's really interesting about your doctor. I've heard kind of mixed opinions from some of my patients where there are other people whose doctors have given them a little bit of leeway, like you said, a range, and working with your doctor to identify what that is. And I think it just requires having that conversation. So when you're planning your visits, write down kind of a list of the things that you have questions about related to exercise. And as Tim said, a lot of doctors will say, wow, that's not something I've been asked before. But I think as the cohort of people with Parkinson's are younger, and generationally, I think our relationship with exercise has changed for kind of the young onset Parkinson's people now, as well as people with like kind of middle stage Parkinson's right now, but compared to like the 90-year-olds, right? Like that generation many of them were not exercising as much now. So hopefully this will be a conversation that the neurologists are used to hearing a little bit more. So I like how it sounds like you worked with your neurologist for that.
And it's also important to remember that, and I just turned 60, so I can't do at 60 what I could at 46. But if you're 46 and just getting started, remember that you can't do at 46 what you did at 20. And it's important to listen to your body and not overdo things, especially with your Parkinson's. It can really throw things into a tailspin if you don't look after yourself.
Yeah, no, that's a really good point too. I had that experience with my getting off the bandwagon here. I might have gotten off of it or gotten back on the bandwagon a little too fast, right? And had, muscle soreness is normal after starting a new exercise routine. And you kind of have to learn like what's good soreness versus bad soreness. And so if you've done bad soreness, rest, recover, but don't stop exercise, just reduce what you were doing. And then get back up, keep going in moderation until you strengthen yourself back up again. Okay, thank you, Tim. Next, I'm going to move on to the section about how exercise can be facilitated and by whom. So this yellow circle here is about professional support. Our healthcare providers, our rehabilitation team, and exercise professionals are all within that domain. But also it's important to note that technology can be really important for facilitating exercise right now. There are so many activity trackers that give you like bells and whistles when you meet your goals. And that's really, it actually releases endogenous dopamine in your head. Not enough to get a boost from your Parkinson's, unfortunately, but it does make you feel good to see yourself meeting your goals. Heart rate monitoring trackers can be really important to help you dose your exercise appropriately. There are different health apps, and there's Parkinson specific apps for helping you track your symptoms. And there's like goal setting apps, whether it's like for weight loss or for exercise, or just things that can track how much you are doing. There are exercise groups, whether it's, going to a boxing class or a Tai Chi class or a yoga class. There's Parkinson specific exercise programs, but there's also non-Parkinson's classes. So especially if you're early in your journey, you can have a conversation with the exercise professional to let them know that you have Parkinson's, particularly if they'll see you with more tremor during your exercise. But you can probably just continue with the exercise classes you're doing right after diagnosis if you're catching it very early. I also would say that there's non-exercise support. So if you're just in a traditional support group or just have a friend that can talk to you and support you for exercise, that can be really important support as well. There are online exercise programs. So if you live in an area where it's hard to get to Parkinson's specific classes, but you'd like that Parkinson's tailored education during your exercise, find an exercise an exercise professional that does live synchronous exercise classes where they can see you over Zoom. Now your box on Zoom is going to be this big, so they're not going to be able to help you if your form is off and you need help with your form for exercise, but they still give you that live interaction, which can be really helpful. There's also online exercise classes that are previously recorded where you can just follow along on your own. So play around with it, find your favorite. And then empowerment is a facilitator. And so this is motivation through people, professionals, and family, through medication management, making sure that your medications are optimized, whether that's your Parkinson's meds or other meds that might help you, just with the motivation to get off the couch. There's a lot more recognition now about how mood, apathy, depression, and anxiety can impact you. And that's because of your Parkinson's. It's not like a failing of one's individual. It's your Parkinson's that is doing that. And so getting on the right medication routine can really help. And just the messages, the different exercise classes have messaging, finding yourself in support groups like the WPC talks that can just help you feel empowered and inspired to exercise. Now, zeroing in on those professionals that can help you, there are physicians, neurologists, primary care doctor, or physiatry, or sometimes called physical medicine and rehabilitation, or PM&R. These are doctors that can help you. The thing is that they are helping you with so many things. And in a visit, they often don't have time to really dive into exercise, and their training on exercise really varies by doctor to doctor. And a lot of it has to do with their personal experience. Exercise professionals are kind of at the other end of the spectrum here. They are not licensed normally, but they do have certification programs. So you can be a certified personal trainer. You can be a certified group exercise professional or group exercise leader, or a certified exercise physiologist. These are people who have special training in exercise. And that's important. You don't necessarily just want like Joe Blow off the street who just likes to do bodybuilding to be your personal trainer. If they don't have the certifications mean that they know all of the safety things. Exercise physiologists know a little bit more about the medically oriented exercise, but they're a little bit fewer and further between. It really depends on where you live about whether you'd have access to an exercise physiologist. But certified personal trainers and group exercise instructors are all over. And then there are licensed exercise professionals like physical therapists. Coverage for physical therapy is through people's insurance, and that differs from country to country and even within a country based on what insurance you have. So, I encourage you to figure out what the coverage is for that in your area, and then to try to find people that are neurologic physical therapists, or they might have NCS by their name for neurologic clinical specialist. And if they have Parkinson's expertise and Parkinson's training, that's even better.
There's a couple of questions here for you, Mariam.
Yeah.
When you're ready, there's a few questions here for you.
Go for it. Jump in.
Okay. Well, I'll just throw in the thought before I get to the questions that if you're looking for online sources, you can go to to pdavengers.org, and we have an exercise portal there that lists dozens and dozens and dozens of free exercise programs, both live and pre-recorded. Lots and lots and lots of stuff there. Included in there is U-turn Parkinson's, but there are lots from around the world that are listed there. But a
Oh, that's a
question for
great
you,
resource.
yeah, a question for you, Miriam, is what if strength exercises make me shake because of PD, not because I've reached my strength limit?
Well, that is different. And then, so if it's just the tremor that's just kind of working its way through the exercise routine, you can work through it. There are starting to be different technologies that people are looking into to maybe dampen tremor, but thus far, none of them have been studied within the context of exercise. So my recommendation would be if it is bothering you and you're feeling like you cannot lift, then talk to a physical therapist and have like lift with them so that they can see what you're doing and see if what it is problematic. The second thing there is you'd have to be a little bit, consider your safety with that. If you're using a free weight and you're shaking a lot, is that a safe exercise for you to do? Perhaps using a gym-based exercise where you're like connected to something with a cable might provide some of the stability that could help keep your body a little bit more comfortable when you're exercising if you have access to that resource. That's kind of my science-based feedback. Tim, I'm curious your experience, if you have a thought on that.
Yeah, I would say very much what you said there. It's that sometimes you simply have to work through the tremor, and sometimes we have to adjust our meds around when we work out because I know that some people do get exacerbated symptoms as they work out, and that some have had to adjust their medication to help offset that.
Great.
But
Thank you.
what's the relationship between exercise and neuroprotective effects?
Great question. So going back to kind of that first slide and the benefits of exercise, right now in humans, the research is that it can improve disease severity score. But the research that's in animals, starting at like mice and going up through non-human primates or monkeys, is that exercise, particularly at vigorous intensities, but moderate to vigorous possibly, can be neuroprotective potentially. So they say it is the most promising, potentially neuroprotective intervention so far. None of the medications that have been studied for neuroprotection have had positive results. So they also treat disease severity and the symptoms at that time, but they aren't changing the underlying disease in the brain. There is one study right now going on that's called Sparks-3. And if you're early in your journey and you have, you're not taking any medications yet, and you're in the United States somewhere, there is likely to be a Sparks-3 site near you. In this study, they are randomizing the group to moderate intensity aerobic exercise or vigorous intensity aerobic exercise. And they're just trying to compare the two different doses because so far that the exercise literature research is so mixed that some studies study moderate to vigorous or moderate and some study vigorous, but there's never been like a really good head-to-head comparison of moderate versus vigorous. And they're looking at like the changes in the brain with that, with imaging. So that when those study is done, that's going to be really exciting to see.
And one of those actually changes our brain?
Potentially both, but the hypothesis is that vigorous intensity would be better than moderate intensity. But they don't really, that's what they don't know. Like in mice, they cut up their brains after they exercise and they can look at how much dopamine is in their brain. But it's only been recently that things like DAT scans and some more advanced imaging technology can actually study how much dopamine is in human brains.
But we're not getting any of those responses from medication.
Medication is also doing symptomatic management. And while the medication is in your system, you've got dopamine in your brain.
Yeah.
But when they do like off medication testing and all of those things, all of the results kind of don't show that protection, that long-term protection. So the medications aren't slowing down your disease. Right now, we don't want to say exercise is slowing down your disease. Exercise is the most promising, potentially neuroprotective intervention.
So if you're going to take medication or exercise for neuroprotection, you're probably going to get further with exercise than you will medication.
For neuroprotection, yes, but for most, all individuals with Parkinson's will need both at some point.
Oh, absolutely. Right? I wouldn't go anywhere without my meds, but
it's that
I'm just trying to draw a point.
Yes, exactly.
Exercise is proving to probably be neuroprotective and slow our disease down.
That is what they think,
Why wouldn't you be exercising?
right? We'll get those people who are rarely exercisers off the couch with that one.
That's my goal.
I wanted to kind of throw it back to Tim again here. He's mentioned some of his U-Turn Parkinson's resources, but I'm curious who or what are influencing your exercise now? Who helps you stay on the bandwagon?
Well, my father, even though he passed away many years ago, continually influences my decisions to exercise because he had a horrible heart, horrible diabetes, and he never lifted a finger any given day to help himself. Died far too early and has inspired me from day one of his illness to look after myself. So the picture that you see there is the second person that motivates me the most. To my right is my wife, Cheryl. She said during Caregivers Month this year that we asked the question of PD Avengers, what can people do to say thank you to their caregivers? She said, just be here, be present, look after yourself in such a way that you can do everything you can to just be here. So that motivates me. Then we've got great people like our dance. This is our dance class at U-Turn. Got two of our instructors there, our volunteers, and all the people that show up at class every day inspire me to keep going because we see the difference that it makes in one another, and we feel better, we walk better, we talk better, everything works better because of coming out and hanging out together. And I would encourage you to check out U-Turn Parkinson's for online. A lot of our classes are online, live online, and there's a great community that exists there.
One of the things in your list of classes here that I notice is that some of your classes are like green, yellow, or orange, red. Can is this like your leveling of classes?
Yes. They start from green, go to yellow, go to orange, go to red. So green is open to anybody. If you have to sit, if you need your walker, if you need your wheelchair, whatever, you can come to that class. And the instructors are all certified instructors. We have everywhere from personal coaches or personal trainers to physiotherapists who work with us. And they all are very well versed in Parkinson's. And if you need to sit, we'll modify the class for you to sit and do your workout. If you are red and fully mobile and have no deficits and can manage yourself completely, we'll tailor the workout to you. But our number one mantra is the magic is in the intensity. If you're going to get any effort, any benefit out of this from a Parkinson's standpoint, you've got to be sweating. Whether you're sitting or standing, you've got to be sweating. This is no nursing home. We're here to work hard.
Great. Yeah, I like that. I think this is something that I think is very important with Parkinson's exercise groups and for any exercise groups is to find the one that matches your needs. And I think sometimes I hear that people go to a support group or they go to an exercise group and they're like, it wasn't for me, it was too easy, or it was too hard, or they just don't like that type of exercising. And it's really important to find the exercise group that works for you, or the personal trainer that kind of works you out and doesn't coddle you because you have Parkinson's disease. Sometimes we hear of people in the community who are like, oh, no, that's okay. Make sure you take a long rest break. And it's like, well, but we need to keep our heart rate up too. So find the people and the programs that are challenging and fun for you. And that will help kind of improve the likelihood that you'll keep going with it. And that you'll
for you, Miriam. Is there any downside to high intensity interval work?
Great question. From a health perspective, no, that's, I mean, in people who don't have Parkinson's, high intensity interval training has been shown to lengthen life expectancy and, have benefits there. So high intensity exercise is the best thing for you with no other complications. Now, if you have knee pain, then doing high intensity, high impact running on a treadmill with intervals is going to be bad for your knee. So you need to get your knee treated if it can be treated. Physical therapy is very good at conservative management of knee pain, back pain, foot pain. It is sometimes a different physical therapist. So like I am really bad at knee pain PT because I'm so hyper specialized in Parkinson's, but in a large city, we're very lucky. I can just send them to one of my colleagues who's great at the knee. They'll send them back to me when their knee is better and we'll get them exercising again. So, treat those other ailments. If you're at risk for falling, then high intensity treadmill running or putting your treadmill on an incline might or might not be safe for you. So work with a professional who can help you find the right thing. The other thing I hear with high intensity exercise, and Tim, you might be able to speak more to this, is that there are some people who do have like a kind of a paradoxical effect of it, where they end up so fatigued after exercising that they have to go home and take a 3-hour nap. Or after they do heavy lifting and strength training, their tremor is worse for like the couple hours after that until they take their next dose of medication. And some of this might speak to kind of like how quickly your body's metabolizing your Parkinson's meds or something. We don't, all of these things are not well studied. So I'm curious your experience, Tim.
Well, I've seen all of the above. And again, it really does come back to knowing your body and how your body responds to things, and not just giving up because one particular exercise didn't work for you. But you'll see in that list of classes there that we offer, Empower You is very much a functional fitness class where a lot of weight training, a lot of agility and balance exercise. And you come out of those classes really sweating, no matter who you are. Golden Gloves is our boxing class, same things. U-Tunes, that's all about our voices. So completely different. Our support groups are completely different. Dance is it's completely different from a functional exercise class. You're still going to get lots of big movement. You're going to get lots of exercise. You'll come out of that class sweating, but it's not the same level of intensity as the others. Same with Tai Chi. So you need to take the time to understand your body, what it's doing, what it needs in medication, and then finding the right class that will meet your need.
Yeah. So I certainly have a conflict of interest here as a physical therapist, but I would say if you're one of the people who just feels horrible after you do high intensity exercise, talk to a physical therapist and let them help guide you. Don't take that as a sign that you shouldn't exercise. The good news is that compared to people who do almost no exercise, people who do light physical activity, they're doing better off with their quality of life. And then people with moderate intensity exercise are doing better than those with light. And then people with vigorous are, have a higher quality of life than those with moderate right now. All of this is related to, it's like cross-sectional. So we can't say that exercise causes the quality of life. It could be that people with a higher quality of life choose to exercise more and harder. But what's good is that if you can't do high intensity, do moderate. It is good for you. It is better for you than not doing anything. So you have to find
right. Good word. Good word. Question for you. Are there studies that encourage lessened medication after a period of exercise?
The SPARKS-2 study, which is the study that was leading up to SPARKS-3, did show that there was like a slight signal. It wasn't necessarily like enough to be a definitive determination, but that fewer people so that's a study where they only are enrolling people who are de novo, not taking any Parkinson's meds. And so at the end of the study, 6 months later, fewer people were on like higher doses of meds, but I think they're still waiting to see. So it might, if it does delay the progression of the disease, it would delay the amount of medications that people are needing. And I have heard people that have been diagnosed and then they started exercising a lot and they were able to like come off their meds a little bit. But ultimately, I mean, medications are going to be necessary for everybody at some point, and they help improve your quality of life as well. So I wouldn't necessarily start exercising with the goal to reduce your medication. You just, you'd just be working with your doctor on that.
Yeah.
So getting back to the slides, an entertaining one here, exercise, some motivation required. And, hopefully what we want is that you'd find a coach, a trainer, a class, an exercise buddy, or a family member who is your partner in this, that is going to help you stay motivated. If not, we also do hear that it can be Parkinson's related concerns. This T-Rex running after you that inspires you to run faster and work out harder. And, what's interesting is that that's what the qualitative research shows, is that there are a lot of people who are motivated by health concerns related to their Parkinson's disease, but it works, whatever gets you out there. I wanted to share just really quickly some of the similarities between professional recommendations from an exercise professional. Their guidelines and their recommendations for working with people with Parkinson's include aerobic strength, BAM or neuromotor, and stretching. All of these things are in the physical therapist recommendations too. Physical therapists also recommend that you participate in community-based exercise. Occasionally, but not as often. Those classes are not often taught by a physical therapist. Sometimes they are, but most often they're taught by the exercise professionals. And then the physical therapist can help you with that behavior change approach of like coaching and trying to, we're not going to see you 3 times a week to do exercise. That's not normally like a billable thing that we can go through insurance on, but I could see you once every 2 weeks. And then once you've got a good routine, I could see you once a month and just try to keep you going to figure out what you need to hold yourself accountable. But physical therapists also are working on your walking. They're using external cues. If you have trouble with any task, whether it's, getting up from a low couch or, knee pain when you're climbing stairs, they do task specific training for those functional tasks. And they're working in an integrated healthcare system. Sometimes they can use telerehabilitation. That really also just depends on where you are. So we're going to maximize motivation. How can we apply the recommendations in a way that is actually motivating? The first thing is to consider that we have to meet our motivation where it is right now, today. And then we have to move through the stages of change. So something called the trans-theoretical model of health behavior change says in order for us to increase exercise, we need to be able to see that the pros are going to outweigh the cons. And I think we've talked a lot today about what those pros are. So if you didn't already know the pros of exercise outweigh the cons, hopefully today gave you some more leverage for that. We also need to increase our confidence. Tim mentioned how he was an exerciser before he was diagnosed, and that means that it was a lot easier for him to keep going. If you are something that have not exercised since college or have never been much of an exerciser, use a professional or use a buddy to help increase your confidence for what you should be doing. It does take learning and practice. It's all just like you don't expect to get good at golf overnight. Exercise is the same thing. It can take practice. And then we have to move through the stages of change. These are the stages of change. They start pre-contemplation. Nobody on this call is in pre-contemplation. This would be where you've never even thought that exercise could possibly be helpful to you. A lot of the research on stages of change comes from smoking cessation or research or weight loss research. So there are people who had not even thought to start doing those good health behaviors. And then you move to contemplation stage, preparation stage, action. So this is where you're exercising regularly, and the maintenance stage where you've been doing it for 6 months without a problem. Now, these are all bidirectional arrows. We could add some crisscrosses in the middle. You can move from a maintenance stage. You could have an injury or illness that puts you back into the contemplation stage where you're thinking gosh, I wish I could exercise. I wish I could exercise, but I can't do it. And now I'm hurting and I'm not going to do it. And you have to go through the whole stages of change again. Hopefully, if you've been in the maintenance stage, it'll be easier to get back there. But, we all kind of go through this process when we're starting a new exercise behavior. So the other thing to know is that exercise fluctuations are the norm. We all fluctuate. When we do research on this, week to week exercise looks like this. We all have bad weeks and good weeks. So what supports do you have in place to help you jump back on the bandwagon? It could be your family and friends who might be pushing you, running after you, or running with you to get onto that bandwagon. It could be the dopamine rush of exercise that once you start exercising, you know that you'll feel better. It could be technology, like better technology, newer technology than this cart in this picture, but there's technology for self-monitoring and accountability. And it could be something as simple as music or something like that, that you can just say, if you link your exercise to listening to music that makes you happy or to watching TV shows while you're exercising, maybe, or reading a book or listening to a book on tape, those are all things that you can do to help you support your exercise. So, I'm going to prompt you, Tim, to think about, I'm curious for you, if there are times where you fell off the bandwagon and what helped you to get back on.
Oh, there's been many a time I've fallen off the bandwagon, Miriam, unfortunately. But it helps me to have a plan in place. And, I gave you my plan earlier. 7 days a week, I'm supposed to be doing something, included Sunday, which is a rest day. Our bodies need rest. We need to plan for it and not feel bad about it when we do rest. But equally important to rest is don't beat yourself up when you do fall off the bandwagon. Like Miriam said, this is a natural state of the human being. We get excited about something. Most of us go crazy for a little while and then fall off. I've got a few friends who are maniac triathletes and they never seem to stop, but that's few and far between. Most of us hit a peak. We're doing great for a while on something, whether it's an illness or a vacation or whatever it is, it knocks us off track for a while. There's nothing wrong with that. The problem comes when we don't get back on the bandwagon. when we're not those three guys there behind the wagon running to catch up. We need to run and catch up and get back on. Perfection is never going to happen for any of us, but consistency, perseverance can. We
Yeah.
can persevere. We can find our way through, and it's really best, like Miriam said, if we can find a community to join, a friend to go with, that accountability, that friendship, that just it makes it fun. It makes it far more enjoyable and helps us stay on the bandwagon.
Yeah, that's great. I didn't put in like this picture, like somebody sitting on the couch way back behind those three guys running, but we
Yeah.
have acknowledge that those people are there. So I just wanted to share the resources. They are on your resource list for some of the resources that I talked about today, and kind of the key takeaways that we have here. Find ways to do 4 different types of exercise and find help to stay motivated. So I want to thank you guys all and remind you again of the 7th World Parkinson's Congress in Phoenix, Arizona. I hope to see you there. And are there any other questions in the chat, Tim, that we should address?
I got one more for you. How much
Okay.
vigorous exercise is needed to make it neuroprotective?
Great question. So the exercise research says 150 minutes a week, which is 5 days a week of 30 minutes of exercise. But I think that some of the recommendations are starting to realize that if you're just doing like treadmill 5 days a week for 30 minutes, you do increase your risk of injury. So probably you want to try to throw in some high intensity circuit strength training in there too. So the Parkinson's Foundation's exercise recommendations are 30 minutes 3 times a week of moderate to high intensity exercise. We try to get everybody to high intensity if they can get there, but with that knowledge that like some people are not going to spend all 30 minutes at high intensity. We work with where the people are at baseline. And then at the other 2 days a week of exercise, or 3 days a week of exercise, in your case, Tim, we might incorporate some cross training in there as well.
Yeah.
Some people can maintain, like people who are triathletes maybe can do 5 days of running or heavy cycling, but that we don't want to increase anybody's risk of injury.
Yeah, no, I find what I do is Mondays are typically a functional fitness class, which is all the above of those 4. We try to incorporate them all, the recommendations. Tuesday is generally a biking day for me. Wednesday is generally back to functional fitness again. Thursday is Tai Chi. Friday is functional fitness again. Maybe throw in a bike ride on Thursday. And then on Saturday is a bike ride or a run. So there's a nice variety of things. I'm not overworking any particular part of me. You know, I really have to watch my shoulders. Lots of arthritis in my shoulders and crap like that. But there's other things that come into life that impact these things, right? You want to make sure that you're cross training well, that you're looking after your whole body, not just pieces of it.
Thanks. Time for maybe one more question.
Yeah, any more questions out there? And while I'm waiting for a question, I'll just remind you that WPC is coming up in World Parkinson's Congress is coming up in 2026. Remind me of the date.
May 24th through 27th.
May 24 to 27, Phoenix, Arizona. I'm going to be there. My wife's going to be there. Probably going to bring a gang from U-Turn Parkinson's to be there. So we need you guys to show up. Put it on your calendar now. Set the date aside. And make sure you come and see me.
On my calendar.
All right. Come see me.
Tim, thank you. It was so great to talk with you today and kind of share this and have you share kind of your exercise journey with the group and with me. It's been great.
Very welcome. It's a pleasure to be here. Thanks a lot.